Hello, my name is Zach, and today I'd like to talk to you about having some cataract surgery, which I personally have had myself just earlier this year. And what fun! No, but really, it isn't too bad. So I've got my list of things that I want to cover with this, so that I don't talk for hours. I might otherwise, but today I kind of just want to go and talk about what it's like to have cataract surgery because when I was going to have it, I feel a lot better about things when I know more about them. And at the time, there was a lot of information talking about what the procedure does, how cataracts grow, and things like that. And there wasn't a lot of first person experience as far as what it's actually like to have cataract surgery. So, I invite you to join me for a beer. I've got Grain Belt Premium myself. I think it's a pretty solid choice. Although, feel free to argue with me, and let's jump into this. So, this video is mostly for people who are about to have surgery or who are wondering what the surgery is like when you actually have it. If you have cataracts, at some point, I cannot stress enough how important it is to encourage you to have the surgery. If being afraid of it or being nervous about it is one of those things that might prevent you from doing it, then I hope that this gives you a little bit of perspective on what that actually entails and gets rid of some of that nervousness. I was definitely very nervous about it. I haven't had a surgery since I was one. I had two. I had a surgery when I was 1 year old and before I was one. So this is about my entire knowledge of having surgeries. What's nice is they don't have to put you under for this. It's a very, very routine surgery. I've had my ophthalmologist and my optometrist both say that out of anything that you can get diagnosed with as far as eyes go, having a cataract is actually the best you can hope for. So there are worse things to have, but that's not always the best way to make you feel better. But this does. It's the easiest possible thing to have performed a surgery on. So that's really nice. If you have a surgery coming up, then you already know that you have to go through the ophthalmologist and the optometrist a couple times to get that taken care of, to know that you need to have the surgery. So I'll skip all of that part and focus, like I said, mostly on just the day of the surgery, except for a couple things. Once they've decided that you should have it and they've got you scheduled, in my case, the ophthalmologist hooked me up with a couple more appointments to make sure we had some pre-surgery things taken care of. They were mostly just health checks, like making sure I would be able to go for surgery and that my eyes had all of their pre-surgery tests done specific to this cataract situation. It's the best way to say it. So they're really easy. A lot of the things that you have to do are just regular optometrist checkup things, doing the glaucoma pressure test and things like that. There's one that I found a little bit uncomfortable, was where they put a plastic kind of thing, like a goggle or a case over your eye that has the cataract, and then they fill it with water and they shine a light in there real quick just to make sure. I think it's a better form of the pressure test because now it actually has water to help pressure it. I'm not sure of all the specifics. I'm not an ophthalmologist, so I don't know. But that was really the only uncomfortable-ish kind of thing. The rest is just super easy. Checking your depth perception and all of that. Fun fact, I was legally blind in my cataract eye, and so she said, well, if you didn't have a good eye, this one, I wouldn't be able to let you drive because you can't see. And she was right. I really couldn't out of that one very well. I could see my peripheral, but I couldn't see what I was looking at. The cataract blocked out the main center of my eye. But anyway, so once all of those tests are good, then you go to the hospital on your day of surgery. For me, we had scheduled it out about a month from when we decided we were going to have the surgery. I say we as in my ophthalmologist and myself. So I had about a month to kind of worry about it, right, is what actually is the real life version of it. But I later found out that all of that worrying was completely unnecessary. It really is, and I can't stress it enough. the easiest surgery you could probably have. It's very intimidating because it's your eye, right? And my thought was always, well, the eye is where the soul lives, is what I've been told or I've read. And so that's what makes it, that's the part that makes this tough. But take my word for it, it's nothing tough. It really isn't. And I'm going to explain why. So on the day of the surgery, you need to have a friend bring you in. I had my coworker bring me in, and he dropped me off, and then went back to work. And I sent him a text, or I let him know again right before I went in for surgery, so he knew when to come back and get me. But I got to the hospital. He dropped me off, and then they put me in my own room, which was nice. And I sat in a chair after I switched out my clothes for my gown. You have to put on a hospital gown. And then they give you an IV in your arm. They don't put any fluid in there. It's just the connection so that they can put stuff in there if they want to, or if they need to. When I say when they need to, what I'm talking about is they gave me something, and I can't remember the name of it. They told me a couple times because I asked about it. It's I just started referring to it as feel-good juice. I don't know what it actually was, but they gave me that about 10 minutes before we went in for surgery, or before I went in for surgery. When they had the OR prepped, they gave me a bump of that, they called it. And I have anxiety too, so I was kind of worried that maybe I was gonna, get a little unhinged from having my perspective change. But that wasn't the case. I didn't feel like I was high or I was drunk or anything. It was just all of a sudden, or not even all of a sudden, it was gradual. I didn't notice it happening, but I was in a better mood. I just felt like I was in a good mood. I was kind of nervous before, and then I went from being nervous to nothing changed, just the nervousness went away, and then I felt better. That was it. You're not doing hard drugs, you're not doing heroin or anything here. It just makes you feel like, hey, you just got done watching your favorite TV show where you saw your favorite kid. If you have a favorite kid, I won't tell anybody. And so it was that kind of a deal. I felt really, really good. So once they had me ready, the chair that I was on was also my bed. And so they pulled up the brakes and they pushed me into the operating room, which was kind of fun. I enjoyed being pushed around that way. Because people make way for you when you're in a giant chair, right? So that was cool. So they rolled me in there, and the important thing to remember when you're going in, or in general about this entire operation, is that the whole procedure, once they start, is ballparked at around 15 minutes. They told me 15 to 20, and I would be surprised if they hit 15. It was probably quicker than 15 minutes. It was really fast. So once they rolled me up there, they put me what they wanted me, and then they reclined me, so I was laying down, which was nice. It's a nice bed, very comfortable. And what they do is, up until this point, from the point of when you're scheduled for surgery, in my case, like I said, a month out, for that month I was taking 2 eye drops every day, once when I woke up and once before I went to bed. So it was 2 drops a day. But when they put you there, or when you're laying in the bed and they're getting you ready, they give you about 6 drops. They gave me 6 or 7. And what that does is it's just more of the same, but it's also, I think, some anti-inflammatory and some anti-germ stuff, just to make sure that you're all sterilized and everybody's good and you're not going to get any germs or anything. So they put that in there, and then they wrap you up. The blankets you're laying on and the padding from the bed, they have kind of a tortilla, like a burrito, right? The nurse comes and he took the ends and he just kind of flipped me up into a burrito, tied me up a little bit, and it's not like I couldn't move. It's just they had my arms. They said put your arms down by your waist, and so I did, and then they wrapped me up. And that's, of course, just that you can't interfere with what the doctor is doing. I mean, you don't want to during the time anyway. You don't really get the need to. It's not like you feel like somebody's attacking you. The doctor really does feel like your friend when it's going on, which is really nice. And they did that, and then they had a little device that holds your eye open. And when I first thought of that, I thought of something nightmarish, right? But that's not the case. All it is it just kind of clips onto your eyelids and it holds your eye open. And the important part here is that the reason that we want to blink our eyes is usually to avoid something going into them, I suppose, or if they dry out. And in this case, because your eye has these drops in there that makes it kind of numb, you can still move your eye around. You don't feel any different. It's just you don't feel your eye drying out. So because of that, you don't have the need to blink your eye. And so it's a little bit uncomfortable to get it set up, but they're so fast that you don't even realize it's happening. They're just that professional and that quick about it. There's no... You don't even have time to fight back if you wanted to. So they're very quick about it. And once it's there, you don't feel like you need to get rid of it. You can tell it's there. It's not, if I had a choice between going to the lake and swimming and doing this, I'd probably choose the lake, but it's not anything crazy. And so they hold your eye open with this device, and then they have a nice bright light in front of you. And in my case, she said, "How do you feel? Is everything okay?" And I said, "Yeah, but that light is extremely bright." And the reason that it kind of hurt was because my eyes were dilated. They were very dilated. And of course, when your eyes are dilated, they take in as much light as they can because that's how our eyes work. And so when you have the brightest light I've ever seen shining into my eye, trying to take in as much as it can, yeah, it hurts. And so I said that, and she said, "Oh, well, give them another bump of that juice." And so they did, and then I didn't care anymore. It's not that I felt any different. It was just that I didn't mind it anymore. It didn't seem as bright, in my opinion. So that right there was probably the most unpleasant part of the entire surgery, is just looking at a bright light for like 30 seconds until they fixed me. That was it. It was just my eye having some discomfort, because at that point, yeah, I did want to blink because I wanted to, but I couldn't. But couple seconds and I was fine. So that was nice. The next step they do is they put this jelly into your eye, and when that happens, it dims the light that comes into your eye. And I told her afterwards, I wish you would have done that at first before you threw the light over, because if I didn't mind the light before, I sure as hell didn't mind it after. My vision it was like putting on sunglasses, right? On my one eye. And I should mention too, your other eye that isn't being operated on, they don't do anything to it. They put like a paper towel or a sheet or something over it, so you can still, it's just kind of like putting a blanket over your head. You can still look through it and whatever. But so yeah, my vision was darkened. I could see the outline of the lights, and that's important because your only job that you have in this entire surgery is to lie on a bed and stare at a light. And that's it. That's the only responsibility you have. And it's not hard to do. I mean, it might seem like there's more to it, but that's it. As the patient being operated on, just lay there and look at a light. And you don't feel when she's going in, doing what she's got to do. It's, you can feel like a little bit of pressure. And I say that in a very light term. Like, it's like, you can feel on the back of your hand if you tap it with your finger. It's kind of like a light version of that. That's really all it feels like. It doesn't hurt. The main thing to take away from this whole thing is it doesn't hurt. It's not that uncomfortable at all, I didn't think. And I think after watching a few other people, it feels that way too. But anyway, there was a really cool point. This is my favorite part of the surgery, was when my vision was darkened, was you're able to see what I later found out is your optic nerve. And I'll post a picture right here. You're seeing it now. This is my actual optic nerve. They have a machine the ophthalmologist does that shows you what your optic nerve looks like in high definition. This is what mine looks like. And it looked exactly like that, except that I felt like I was in a room, a big room, looking at it. And the best way I can describe it is, in the best way possible, I felt like I was floating in space, very relaxed, looking at galaxies. Because when you're experiencing this, seeing your optic nerve from that point of view, you feel like you're in space looking at a galaxy, and it's very relaxing. Any nervousness I may have had was gone at that point, for a couple of reasons, right? It's because you can't see what she's doing. You can't see her tools in front of you. You can't see anything except the outline of this light, and that's really actually very comforting. And then just because of the way that you experience this, or that I experienced this, Like I said, I felt like I was in space and it was very relaxing. So I felt great. I felt great the entire time. And I had asked her ahead of time, hey, can we have some music on? I heard that we could have the radio on when you're doing this. And she said, yeah. And it was funny because she talked to her team member and she's like, hey, turn the radio on. This guy wants to rock out while we're doing this. Like, you got it, boss. So we had some music on, and then she was talking to me the entire time, and I was talking to her a bunch. And I think that's common from a lot of people. She said that a lot of people, some people like to just kind of keep to themselves and they zone out, and some people like to talk to her, and I was one of the ones who talked to her. And I had said also, like, hey, please tell me what you're doing as you're doing it, because I like to know what's going on just so I have an idea. It makes me feel better. And so she did. She said, okay, now I'm doing this. And then she'd do it, and then she'd update me again. And like I said, the whole thing was less than 15 minutes, and so it was really quick. There weren't a lot of steps. So from my point of view, it was really easy going. And then once she was done, they pulled the jelly back out again. When I think about it, I don't even know when it came out. It just was out. I mean, it's really quick. It's very, very fast. And she pushed away. She was on a chair that had wheels that she was sitting in. And she pushed back when she was done. And I think in the time it took her to push back, the nurse came in and put on this guy, this little eye guard thing like that, and just duct taped the thing on. And then they were already pushing me out before she'd even stopped moving her chair. They were like I don't know, medical Green Berets or something. They were just quick. They knew exactly what they were doing. They were very professional. They obviously had done this many times before, and they just did it. And so yeah, she's like, all right, well, we'll see you later. And she's, like I said before, she was taking her gloves off or done moving her chair. I was already out the door again. So after the surgery was done, they brought me back to my little private hospital room. And they said, when you're ready, stand up and change back into your regular clothes and, maybe text your friend to let him know that you are done now and we'll get a wheelchair for you. So I'm like, okay. So I did that. I let my friend know, and my work is maybe 15 minutes away from where the hospital was. So I told them, okay, knock, knock, hey, I'm ready to go. And they had a lady come in and they're like, well, we're going to have to wheel you out because that's policy. So, okay. So this lady gave me a free ride in a wheelchair all the way out to the front of the hospital, which that was probably my second favorite part of the entire thing, was just, I felt like I was getting the Rockefeller treatment. They were just driving me. I was like, oh yeah, I'm important. Somebody's pushing me around. I got this free ride in my wheelchair down to the front of the hospital. So that was kind of fun. And yeah, I had no problem standing. I wasn't woozy. I didn't feel different. I still felt like I was in a great mood. And my friend was there, so he helped me make sure I got into the car. And I said, I'm really, really hungry. So we went and got some food right after, and then I just spent the rest of the day hanging out, taking a nap or watching TV, and that was it. I mean, don't count on being able to see through this thing too well. It does have holes for it. You can see through it, but there was so much tape over it that it didn't really matter. And you can see immediately after the surgery. You can see through your eye. It's not like it's a blur or anything. I mean, it's blurry-ish, but you're not blind in that eye. What I will say is that the best way to describe it is you have this tinge, this kind of hue, like a golden. It actually is a lot like my beer, and that's one of the reasons I put it on here, is it's a lot like that. It's about that color. It's kind of a golden hue that you just see over your vision for a couple days while your eye heals. And it's nothing too crazy. Your eye needs to have I think a couple more drops put in for, I believe it was 2 weeks after I got done. So I put drops in again twice a day once I was done with the surgery for a couple weeks. And they'll have you keep the eye guard on for, I can't remember if it was a day or if it was 2 or 3 days straight. You can't take it off. And then after that, you can take it off while you're awake. But if you take a nap or whenever you go to bed, you need to make sure you put it on and you wear it, because if you're sleeping and you scratch in your sleep, that's going to inhibit healing. Or if you roll over on your eye or something, that's not good either. And your your eyelid, if you get like some dust in there, that can scratch your eye when it's healing, and you don't want that. So, you want to wear it. It's in your best interest to wear it. And here's a tip. This is my personal tip after having done this, is that the nurse used tape. And so once I started taking it off to go to sleep, I was using tape to put it back on. Or once I started taking it off to be awake and I put it back on to go to sleep, I was using medical masking tape, whatever it is. Kind of what you'd wrap a Band-Aid, or not a Band-Aid, but like gauze with, that kind of medical, this kind of masking tape. And it was falling off because if tape comes off once, especially on your skin has oil, so it's really tough to push it back on again. So what I recommend is getting a nice bandana. Get a really soft bandana, because you can buy cheap bandanas. I don't recommend those. They're scratchy. Get a really nice soft bandana. And then I'm not going to put this on now because this has been sitting around for months and I don't think it's clean anymore. But you put it on over your eye, obviously. And then you just put on the bandana kind of like, just fold it up like that. And let me flip it the right way. Like this. And you can wear it over your head like this. What's nice about this is, well, besides looking great and bringing all of the ladies to your house with this kind of look, is that unlike masking tape or tape, like I said, tape will get less sticky if you have to keep pushing it back on. If it falls off when you're sleeping in the middle of the night, this, you just tighten. I always tie double knots in the back. I get it so it's not super tight, so it's not cutting off my circulation to anything, but enough to hold it on. And then I just double knot it, and it stays on perfectly. So if I want to take a nap, I just have my bandana nearby me. I tie it on. It doesn't come off when you're sleeping. I think it holds it on better because you have more coverage. Tape will only hold it on so far, and these things are shaped in a general sense. They're not form-fitted to your eye, so they move around if you just tape them. But if you use the bandana, it puts pressure across the entire thing. And so that really helps out a lot. And, I mean, you don't have to keep buying tape, so that's good too. I think I've got pretty much everything taken care of from my list here. I want to make sure. But that's really what it is. That's the entire process of day of surgery for having cataract surgery. It sounds, when you hear about what it is, it sounds way worse than it actually is. The bark is way worse than the bite. It's not bad. I will probably have to have a second one, I'm sure, at some point in my life. Hopefully, knock on wood, not for a long time. But when I do, I'm positive I won't feel nearly as nervous or anxious about it, because I know that it seems scary, but it's not. It's super, super easy. And if you have any nervousness about it, I hope that this has put some of that nervousness at ease, because, like I said, there isn't a lot of information about it that isn't just very straightforward medical, like this is what's going to happen. You're going to have this, and the doctor's going to do this, and that's it. This is a personal experience, described the best way that I think I can. It's very positive. The bright light was the only real uncomfortable part of the entire thing. I'm sure your doctor that you have for it will be, I'm moving my camera around, I'm sure the doctor you have for it will be very experienced like mine was, and very professional. And like I said, this is a super easy, everyday outpatient surgery for them. So it's nothing big at all. So yeah, I hope that this has helped out anybody who may be having surgery soon or in the future. And yeah, goodbye.